something that is, been such a big part of your life in the last few years, and people who don't know you may be almost surprised at where we're going in this discussion now. But this discussion could basically continue down the path. If we could talk more about diabetes, we could end this discussion here, and people would say, wow, that's a really insightful, thoughtful person. But there's a whole other side to your experience with healthcare, Sarah, that started, almost 4 years ago. And I'll tell the beginning of the story just from my end. So you and I obviously met each other through Virta. You're an early part of the creation of this company, which is basically scaling up a way to remotely treat patients with type 2 diabetes. This is a company that Steve Phinney is also a co-founder of, along with Jeff Volek, I believe. I have a minimal involvement in that company. I'm a small investor and at one point was an advisor. But it was during one of these advisory meetings that you and I happened to be sitting next to each other. Now, we'd met many times before that, but I do remember this very well. It was, I think, June of 2017. It was up in San Francisco, a large U-shaped table in the room, and it was a 2-day ordeal, and you were sitting to my left, and that gave us more time than most times to be chatting about this, that, and the other thing. And you looked in perfect health as always, and at the end of the second day I said goodbye and see you next time and blah 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 blah. And then about a month later I heard from a mutual friend that you had been diagnosed with lung cancer. And I just about fell off my chair. So can you tell people what happened that summer, the summer of 2017?
Yeah, so, I'll just start by saying I've been someone who's taking care of themselves to the max, all my life. Eaten well, I've kept my weight at a normal weight, even 9 months pregnant, I would have still been considered normal weight. Exercised like crazy, competed in, half marathons, triathlons, Olympic distance, I did everything right. Never smoked, never drank to excess. And, it was June 30th. So right after that, it was June 30th of 2017. I was having a normal day. Went to exercise. I had a big IRB meeting in the morning. Went home due to my wonderfully full house of 3 kids, and took a business call in the basement, because that's always my escape place, where it can be a little less noisy. And all of a sudden I couldn't talk, and I couldn't figure out what was going on. I knew something wasn't right, but I couldn't speak. And all I know is that I hung up the phone at some point because I was embarrassed. Remember thinking he's gonna think I'm drunk. I hung up the phone, and the next thing I remember was being in the car with my husband and him saying, I don't think we could take you to urgent care. I have just very flashes of this day. And the next memory is in the trauma bay at the hospital that I work at, where I had seen patients many, many times. And I'll have to tell you, the other thing is the last time I had been in that particular trauma bay was when I brought my then 4-year-old daughter in, or my husband did. I met them via an ambulance after a traumatic brain injury. So it was like a very bad place for me, although my daughter completely recovered. And I remember screaming at my husband that they're wrong, and I wanted to see the computer. Because what had happened when they first came in is they thought it was a stroke. And so my poor husband was all of a sudden tasked with, are you going to give her clot-busting medication or not? Because we think she's having a stroke. But lo and behold, the imaging showed a really large tumor in my brain. Then they imaged the rest of me, and it turns out I had multiple tumors in my chest. And so, they presumed, correctly at that point, that this was lung cancer, but I also needed emergency brain surgery. And this is all, I remember most of this by people telling me about it. So anyway, the next day I had emergent brain surgery. And then, being a physician and lung cancer, I was like, that can't possibly be. I have never smoked. How do I have lung cancer? I am the healthiest person I know. I remember being in the hospital because, of course, you're on drugs and everything else and shock and everything. And I kept saying, look at my nails. These are the healthiest nails you've ever seen. How can this be a person who's sick? Because somehow that was like just one example, of how that's impossible. Talk about the stages of grief and denial, right? And being a physician and knowing what lung cancer meant, the next thing that came out of my mouth is I want to move to Oregon. Because I was like, I know what this means for me, and I know what this means for my family, and I don't want to play any part in this. I don't want them suffering.
Can you tell folks what you mean by that? Not everybody might understand the implication of what you're saying.
Yeah. I wanted to go to Oregon because they had physician-assisted suicide. Because I knew I have treated so many patients with lung cancer. I knew the horrible end. I knew what this meant,
especially when it's spread.
Yeah, and it had spread everywhere. I mean, I had stage 4 lung cancer. The day before I had been fine, 100% fine. That morning I had exercised vigorously. And suddenly I'm in the hospital recovering from a brain surgery, being told that I have a rapidly fatal disease. And, all you can think of in that moment of panic is your family, right? And so, my only thought was, I don't want them to watch me go. I want them to remember mom. And so, there began my so far almost 4-year journey of a new me. Cancer changes you. So I'm not that person, and one of the many things is sometimes at this point in time, I mourn that person.
One of the things that I think is very shocking for people to understand is that probably between 12 to 14% of people who get lung cancer are not smokers. And they all tend to get a certain type of lung cancer. Lung cancer is broadly divided histologically by small cell and large cell, or non-small cell, I'm sorry. And within the non-small cell, there's large cell, adenocarcinoma, squamous cell. And most of the people like you who are not smokers get this type of adenocarcinoma, non-small cell. And it is really shocking to think that given the prevalence of lung cancer and the lethality of lung cancer kills more people than any other cancer. And I believe that's true for male and female still. To think
yes, by far.
Yeah, to think that such a high percentage, 12 to 14%, could be non-smokers tells us the severity of this. I also think it's worth reiterating something you've said, which is sort of the miracle of the fact that we're sitting here having this discussion 4 years later. The median survival, meaning if you took 100 people with stage 4, which means a type of cancer that has spread from its original site of origin, and in your case it went to your brain, which is a particularly devastating place for this cancer to grow. The median survival of people with stage 4 lung cancer is probably 12 months or less, correct?
Well, it depends on what kind of lung cancer that you have. But yeah, and sometimes even 8 months or less. Those were the stats that I knew when I was first diagnosed. And, one of the things that I'll say is non-smoking lung cancer is growing at scary rates. It's being diagnosed and it hits people in their prime. It's growing rapidly, especially in young women. So it's hitting a lot of moms. Much more common in women than it is in men, although it does happen in men. Happens in Caucasian and Asian women predominantly. And the interesting thing is most of the people that it impacts are thin and in shape or athletes.
Do we have any insight into why?
No, and it's one of the things that's not being investigated as much. When you look at, okay, what studies have been out there? Oh, we get the typical, it's radon, it's, being next to a smoker. I never was, okay? My father was a smoker. He quit smoking the day I was born and never went back. I was not raised around smoke. So, the fact of who it's impacting and the fact that the demographics of the people that it's impacting are the healthy people, unlike what we associate with, our epidemic of insulin resistance. That's not who these people are. We know that insulin resistance is responsible for a huge number of cancers and cancer rises. That's not this. And so, it's young women, and again, who have presumably done everything right. And it's something that is not getting enough press. I know The Guardian did a big story about it about a year ago, but otherwise it's not getting the attention it deserves. And these women really wind up with two different kinds of cancer. They wind up with EGFR-driven cancer, that's epidermal growth factor receptor, or they wind up with something called ALK-positive cancer. I have the EGFR, specifically something called EGFR exon 19 mutation. And the thing I didn't know at diagnosis, because again, I had been focused on obesity and metabolic disease and diabetes for so long, I hadn't been seeing as many people with active cancer as I did when I was in primary care. And so I was quite frankly behind on some of the newer treatments and newer diagnoses, if you will, and we're talking the genomics of cancer. But for EGFR cancer, there was something called a targeted therapy. This class of medications is called tyrosine kinase inhibitors, and people can go on them and they can get better. Okay, they can even in many cases have all of the cancer go away. Okay, doesn't mean they're cured though, because it always comes back. And so after initially, again, going through all these, I'll tell you the denial grief stage.
Well, I want to actually ask you exactly about that, Sarah. I want to go back to, what is it like when you were recovering in the hospital from the brain surgery? Because I assume they had not taken out the primary tumors in your lungs. They were just alleviating the most life-threatening symptom you had at the moment, which was a mass inside a part of your body that can't accommodate a mass, which is why you had a seizure. So they take that out. You're recovering from a surgery that by itself is difficult to recover from, but then coupled with the knowledge of, here's this disease and my lungs are full of this. What do you remember of those days?
Overwhelming grief to the point of not being able to think. And again, it's of course I come and approach everything in life as a mother, right? And I'm not saying as a mother only, like fathers would do the same thing, but you approach every problem in life through what it means for your children.
How old were your children at the time, Sarah?
They were 7, 12, and 14. And they needed me. They still need me. And so the grief is overwhelming. About what I quickly realized is I'm going to break my children's heart. And there's not a thing I can do about it. And to have that realization, because it comes quick, and have to sit with that is a grief I can't even explain. And So, I mean, initially I couldn't handle the grief. I had to be in denial. I came home from the hospital. I had just been discharged from ICU, and I walked 7 miles the day I got home. And my feeling was, see, I can't be sick. I just got out of the brain surgery. I'm still on medication. I walked 7 miles today. I'm healthy. I don't know what you people are talking about.
What did your kids know at this time? Had your husband already spoken with them?
Well, sadly enough, and I actually didn't find this out until quite a bit later, they are the ones who found me in the basement. So, you know, talk about not telling the children. That was never an option for us. So, you know, they knew I was having surgery, that there was a tumor in my brain, and that this was cancer. This is not good. And that's a lot for a kid to unpack, right? Especially a kid, you know, again, I mean, it's hard for any kid to unpack, but you know, one of the things I remember when my kids were going through each of their own, kid goes through it, the phase of, what if something happens to you, mommy? What if something happens to you, daddy, right? All kids go through that. And the one thing we used to kind of laugh together, my husband and I, about that. Say, oh, honey, your mommy and daddy are the healthiest people. We are so healthy. You know, you don't need to worry about that. And I remember that. You know, it's one of the first things that you think of when you're put in this situation is, oh my God. You know, they have to unpack this in that context. And it's hard to be a teen. It's hard to be a 7-year-old. But to be one whose mother suddenly had a, you know, diagnosis of advanced cancer. And it was a hard decision on what to do, but, you know, in talking and how do we handle the kids. But the one thing we decided together, I mean, my husband and I, is that we were never going to lie to them. You know, we were always going to tell them the truth, because I thought that the worst thing for a kid is to constantly be wondering if there's going to be a huge shoe that drops. And so we told them, we tried to open up the lines of communication. They mostly didn't want to talk about it. But we told them that we were making that promise to them, and we have never gone back on that promise and never will. I mean, that's one that it's really important to me. We may delay telling them something for a little bit until we really know the facts, but as soon as we really know the facts, they're going to hear about it. So anyway, I mean, you know, and over time in grief, you learn to accept many things. You know, my husband and I, our dream had been to retire to a farm and make gourmet butter. Like, that's what we were going to do. That was going to be the second career, right? And you learn to make peace with that's not the case anymore. You know, we always used to joke that the way we wanted to die was 95 years old on the way home from a skiing trip in a fiery car accident where our kids would not have to deal with the bodies, right?
The cremation,
but we wanted to make sure it was on the way home.
Yeah.
A twofer. It was going to be on the way home because we were going to be having fun up until that point. You know, so that's acceptance. You know, you're not going to retire. You're not going to have all these things. But you can't accept that you're not going to be a mom. Impossible.
Now, at some point, I'm guessing kind of the problem solver in you started saying like, hey, I'm going to learn as much as can be known about this. And we're going to talk about this in the context of the asymmetry that exists. I just had a discussion about this with, you know, we have a weekly meeting in our practice with all the providers, and We just had this weird situation recently where, basically a patient of ours who has another physician was kind of caught in the middle of a recommendation that turned out not to be the right recommendation. And, we were able to get them a referral to somebody else who basically got them out of a very unnecessary surgery. And we were just sort of thinking, man, like, we're so glad that patient was able to dodge that bullet. They were going to have a surgery that they totally didn't need. That's a very big surgery with lots of risks. And we realized, like, the asymmetry of knowledge in medicine is so overwhelming that it's not even just about money or education outside of medicine. Like, a smart person still has a hard time digesting medical literature. And I know, like I said, we're going to talk about this, but you very quickly must have figured out, hey, I have this EGFR 19 deletion. So we no longer talk about this as you have lung cancer, or you have adeno, or you have non-small cell. We're really going to refer to it by its mutation, and everything will come down to how do we treat that. How long was that process for you to say, I'm going to, I don't know if this is the right word, but I'm going to partition my grief and my problem-solving brains, and I'll do both of them, but I'll move back and forth?
Pretty quick. It happened pretty quick, which is, okay, this is terminal, right? You have to come to grasp at that, but terminal when, right? And what can I do to control the when?
But when you say that, Sarah, did you really come to that realization so soon? Because technically life is terminal. I mean, there's nobody listening to this podcast, watching this video, who isn't going to die. So that's all terminal. But when you say that, do you mean that immediately and without question or reservation, you felt that you would not live a normal life expectancy? There was no Hail Mary out there that was going to, take you to being the 95-year-old skier?
Yeah. I mean, I think just the reading and understanding, although the advances, that this was going to be terminal really soon, in my life. And I was only 46 at the time. And, my first thing was just, please let me make it to 50. I'm 49.
You're going to be 50 soon.
Yeah, I'm going to be 50 in the not too distant future. So, that was like my first one, was just like, okay, let's, but right from the beginning, I'll tell you, the when was 11 years. Okay. And that has not left. I don't need to be 95. I can accept all those things that I'm going to miss out on by not growing old. I just need 11 years, which to everyone was unrealistic. But why 11 years? Because my youngest would be graduated. So immediately, my goal was, I can't settle for less than 11 years. I have to make it to 11 years. And so in became that, like, my war cry, 11 years, 11 years. I have to make it 11 years. And so, it started, and that started me on a path of so much. So the first thing I thought in reading read everything, is I got to get this primary tumor out. I'm considered inoperable, but we know that having this primary tumor here increases my risk for mutations. Okay, remember I said that the tyrosine kinase inhibitors, or the TKIs, they work amazingly well, but only so long. Somewhere between 8 and say, on average 8, and with the more advanced ones, at the long end is like, 24 to 30 months, okay? So that's not enough time. That doesn't get me to 11. So I was like, okay, this is increasing the risk for mutation, which is how these develop resistance to the tyrosine kinase inhibitors.
And remind me, Sarah, you, because I remember you emailing me probably by August and starting to, explain some of the details. Your biggest tumor was like 5 centimeters. That's a monster tumor. How many tumors did you have? It was 6 centimeters, or you had 6 tumors?
It was 6 centimeters.
Wow.
Mm-hmm. Which is amazing in the sense that I never had pain from it. I never had a cough.
Probably because you were so healthy.
I think so, because, this talk about being caught out of the blue, there just wasn't this premonition of something is awry and I'm just not addressing it.
And so the standard of care, sorry to interrupt, was just that, we typically don't operate on patients with metastatic tumors. The only reason they operated on your brain was it was an acute way to save your life. I think it's hard for patients listening to this to understand that, but that's sort of that's the playbook in oncology, right? When a patient shows up with metastatic cancer, they're considered not surgical candidates. And this was the exception and not the rule. You were going to be dead probably within days if they didn't operate on your brain. But all this time afterwards, you still have this burden of tumors in your lung. And now the question is, can we improve your prognosis? And maybe that doesn't mean you live to 95, but can we make your cancer less resistant to therapy by taking the majority of the cancer cells out of your body?
Right. And decreasing the tumor burden. Because really quickly, the TKI got rid of every single small tumor. I had them throughout, like paint splatters throughout both lungs. And they were gone in a matter of weeks.
That's staggering, isn't it?
I mean, it is. It's remarkable. But the primary tumor was huge. So I had, unfortunately, the large tumor in my brain was not the only one. I had 2 other ones that they radiated. They didn't need to be surgically removed. They were small. They could be radiated. And then I set about trying to find someone who would take out this primary tumor.
Can I ask you about the stereotactic radiation, Sarah? That's, I mean, we glossed over that, but that's not a benign process either. Did you suffer nausea from that? How difficult was your stereotactic treatment? Did you take it all in stride?
I did great with the treatment to the brain. I didn't have any issues. I did have issues at the beginning, but they were more to the TKI. One of the things with every specialist that I saw, they couldn't believe it, or they told me if I saw them earlier, it wasn't going to happen. At least you'll keep your hair. All my hair fell out. Like it wasn't supposed to happen. Like your hair is not supposed to fall out with TKIs. All my hair fell out. Anyway, so the brain radiation went fine. And then I met a surgeon who was going to take out the primary tumor for the reasons that I was saying. Anything to decrease the risk of, developing a mutation that keeps me from being sensitive to the TKIs. And so I went in, for surgery in September. And I can remember her saying, we're going to take this tumor out. We're going to take out your right upper lobe, unless, of course, we've seen that there's disease in the mediastinum. But there was no disease on the PET scan in the mediastinum. So she was feeling pretty positive about being able to take that out. But I knew for several weeks beforehand that that was a possibility.
And just so folks know what we're saying, on the right-hand side, you've got these 3 lobes here, but they drain into these lymph nodes that are in this middle structure called the mediastinum. And so you had this monster tumor that was going to require the entire upper right lobe to be taken out. But if the surgeon felt that on visual inspection at least, or maybe even sampling nodes, that any of those nodes had cancer, it was her opinion that this is really futile because now we know it's already escaped the lung. It doesn't matter. So you went into that surgery knowing you could wake up with a huge scar in your chest tubes coming out, and the cancer is still in you, right?
And that happened. And that was, I mean, it was terrible. I mean, you know, I kept apparently, you know, under the influence. I mean, everyone told me I was so hysterical, screaming in the recovery room, I'm a mom. You can't let this happen to me. I'm a mom. That's all I kept saying. And I, of course, don't remember any of this, but they had to actually take me away, put me in a private room. And that was all that I kept saying. And so, you know, I had to come home and learn to accept that. I now was bald. And I was definitely fell into a deep depression, but at the same time, you know, I refused to completely give up. I mean, like, for example, I went back to work at the clinic the same month that I had brain surgery, you know, which sounds crazy, but it's just part of this whole process. And then, but after the surgery failure, that was terrible. And then I didn't really recover back into my determined place until a really very specific moment. And that was just a couple of weeks before my diagnosis. I had been selected to be an Aspen Health Innovator Fellow, which was, I mean, this is among the highest honors for your work. You know, the Aspen Institute is, you know, a place that brings together thinkers in all kinds of disciplines, and, you know, to be chosen to represent people who are innovating in the healthcare space was, I mean, such an honor. And in order to do that, you had to commit to 4 weeks of leadership sessions in the next 2 years, which of course at the time I was like, of course, sign me up. But as that first session inched closer, it was in November, I was so, what do I do? I couldn't make up my mind. I literally didn't make up my mind for sure until I got on the airplane. And because I was ready to run back, because it was like, I'm going to leave my kids for almost a week. I have terminal cancer. And at that point I decided, you can live feeling sorry for yourself and of all the things that you're going to lose, or you can go out and live, and your kids are going to be better for it. This is what really made me decide. Your kids are going to be better if you choose to live. And so that was the moment, sitting on that plane seat, crying. I've cried on a lot of planes since this diagnosis, deciding I just chose to live. This was a moment. I made my choice. Now I got to stick with it. And that's how I've tried to live my life since then. Because I have a platform. I had a platform. I had done what I feel was a lot of good for a lot of people, and it wasn't finished. And I knew that this was good for my children. And I'll tell you, one of the most impactful moments of my whole life happened before my diagnosis. And it was one of these times where we were at the dinner table and the lottery happened to be one of those, you know, hyperinflated lotteries. Oh my God, you can win, you know, bajillion dollars. And so my husband and I were at the dinner table joking around about it, right? I mean, we don't play the lottery, but we were joking around, maybe we should buy tickets, you know, we could retire. And here at the time was my 13-year-old son at the dinner table. And he got really upset about us discussing this. You can't retire, Mom. You're doing so much good for the world. How could you even think of it? I've never been so, that is a defining moment of my life. And like, I was like, oh my God. You know, at the time, I was so taken aback by that. And certainly that weighed heavily on my decision to get on that plane and to continue doing what I'm doing. And what I'm doing has morphed since my cancer diagnosis into an even greater focus on health equity because of my experience as a cancer patient and someone who is privileged. Because I'll tell you, you have a much greater chance of surviving cancer if you are has privilege, one of the lucky ones. And I didn't realize the stark differences until I became a patient.
I want to talk about that in some detail, Sarah, but I want to also understand how it is that we're still talking today, frankly. In other words, how have you managed to stay in an equilibrium with this disease, right? Let me share with you a couple of things that I've always struggled with when thinking about cancer. I'm not fond of the language that we sometimes use around cancer, and that we beat cancer, and that, we can't give up and things like that, because it almost suggests that the patients who don't survive cancer have somehow given up. And I just don't find that, in my experience, having taken care of many patients with cancer, to be true. I think it doesn't make sense to me. And I think the way that you said it and described it earlier makes the most sense, which is basically finding a way to coexist with your cancer for as long as possible. And you've exceeded all odds. And I want to kind of understand that journey a little bit more. It's one thing to go through the tyrosine kinase inhibitor, have this immediate response that's remarkable, but then get this setback, 3 months later, where your primary is not only still there, but you actually realize now there's mediastinal involvement, which basically means there's no question you have cancer cells elsewhere in your body. It's not like they stop when they get to the lymph nodes. So pick the story up for us in terms of what your ongoing treatment has been like. How have you stayed in this state of equilibrium, so to speak?
Yeah, so I haven't, okay? On many occasions, I haven't. But so after the surgery, the next thing that happened is they found another brain tumor. There's argument as to whether it was there from the get-go or whether it was something new. But either way, they decided it would be considered that the first line TKI that they had put me on had failed me. And so I got more radiation to the brain, and I was switched to the newest TKI, happens to be called osimertinib or Tagrisso. I was put on that in November, right before I went off for my first Aspen Leadership Conference. And I had decided that I do not accept being a sitting duck, because what the cancer world then, wants is for a patient like me to just sit and wait for the cancer to come back, right? That's what you're doing. It's coming back. There's no question about it. And it's coming back soon. And, you are just waiting. And I couldn't accept that as a mother. I think I could accept it as a human, but I couldn't accept it as a mother. And so I went on a journey to find someone who could treat me in the most aggressive way possible, who shared my view that sitting around and waiting for this to come back was totally unacceptable. I traveled the country. I saw everybody. Let me tell you. First of all, of course, that shows I have means to do that, right? That a lot of other people don't. And I actually, along the way, met another mother, physician, my age, just a bit younger, younger kids who had the same attitude towards it. I refused to accept this. We sort of became a team, so to speak, and wound up by complete serendipity meeting a group of physicians who really felt that the way to treat this long term was to be constantly battling it with something new. So in other words, the cancer dogma right now is you put people on something at the highest dose possible and you keep going until it doesn't work anymore. That's how we deal with cancer. And then we switch, and it's the same thing over again. And the idea is, what if we hit it with less and then change it up all the time, right? And this goes to the idea of beating the mutations before they can get you. So thankfully, I had a physician here at home who was willing to say, okay, that is worth a shot. February of 2019, okay, because it took a long time to get to this point, right, of searching, trying to find something. I started chemo, regular chemo. I went through the regular cycles of chemo. And then when I was done with that, I immediately went to anti-estrogen therapy, okay, because I had a very specific mutation besides the EGFR one, and there was a medication to treat it. It just so happened to be a breast cancer medication, but it was the same mutation for either cancer. So immediately upon stopping the chemo, I went on the anti-estrogen therapy. So I was put into early menopause with a number of, regular medications, Lupron, fulvestrant, and then I was started on a medication called palbociclib, okay, which again is primarily a breast cancer medication, but was targeting one of my very specific secondary mutations. I was on that for the summer, and all this time I'm still on the Tagrisso or osimertinib. That never stopped. As soon as the 8 weeks of that was over with, I went back on chemo, but very different. Low dose chemo. Single agent, very low dose.
Which agent?
So the first one was cisplatin.
Ugh.
Okay. And, everyone says, oh, cisplatin, you're going to do terrible on this. I mean, this is harsh. And it is. But, I did fine. I was able to still, I'm not saying I wasn't tired. I've basically been nauseous for the last almost 4 years, every single day. It's just you learn to manage that, So I learned to manage it. I learned to manage, being tired and the things that came along. I still traveled for work. I was still able to do everything. I can't imagine, I could tell you some really crazy stories of things I had to do while traveling to accommodate how I was feeling that nobody knew about at the time. But anyway, some really wacky stuff that you do, but you manage, you figure it out, right? You improvise, lots of improvising. And then I got switched to after 8 weeks, got switched to gemcitabine or Gemzar.
Which again, these are so crazy. You just don't think of this because that's a drug that's typically used in pancreatic cancer, right?
Well, yeah, and it can be used in lung cancer.
I mean, it just
too.
depends on the mutation.
And
I think that's the point, right?
Right, yeah. Believe it or not, there's no standard chemo for lung cancer. Can you believe that? There's not a standard of care regimen. So the thing is, I wasn't doing any outlandish things here. Okay, these are all treatments for lung cancer. Okay, I mean, like you said, Gemzar is used more for other things, but this is not an outlandish thing that's never heard of for lung cancer. I mean, same with cisplatin. I mean, none of these things are, I was, oh my goodness, we're gonna, do something, that's never ever been done before, so to speak. Things.
And at this point, which is now the fall of 2019, Where, if you go and get a PET scan, where do you actually have tumor in your body at this point?
So yeah, let me back up for a second because, well, the quick answer is I had no tumor.
Okay.
There was no tumor anywhere. And to back up is that the Tagrisso, this is pre-chemo, had stopped shrinking my primary tumor in March of 2018. So this was, almost a year before I began chemo. And so since they wouldn't surgically operate it to get it out, I had it radiated. Again, I was lucky enough to have a radiation oncologist who worked with me. And like I said, I tolerated brain chemo well. The same was not the case.
Brain radiation.
For lung, to the lung.
Yeah, the radiation.
I had real issues. And interestingly enough, we were leaving to hike the Inca Trail in May of that year. So I had radiation and we were leaving to hike the Inca Trail, and I started having kind of bad chest pain. It was like a day or two before we hiked the Inca Trail. I was like, okay, I'm sure this is just reflux. I'm gonna take some reflux medication. And then I was like, look, okay, if it's more, what a better place to die than surrounded by your family, on the Inca Trail and all the beauties of the Andes Mountains. Okay, I can accept this. Let's go. I didn't even tell anyone. I was like, going forward. And did that successfully. It was great. My 8-year-old tootling along, she was always the fastest of any of us. We went with our friends, and amazing experience. I just have to say that it's those things, especially if you can get kids in it, I'll never forget that when we all got back and we went and checked into the JW because we were like, give me a shower, a very clean bed, and a spa. My middle child, my daughter, said to all of the adults, I developed my third eye during that. Mm. It was one of those experiences. Wow. Like, you don't normally think you're going to get that out of she was, 14 at the time. We were all like, what? Mm-hmm. But anyway, so it was a super special time. I was still having pain, and then my rest of my family flew home. I actually had to fly from Lisbon to Switzerland because I had a conference I had to go to. And at that conference, things started to get really bad. I made it through, but, not with, again, some funny stories of how I accommodated to it because I was having crushing pain. Got home, turns out, of course, I had this rare complication where it actually impacted my bones. And my radiation oncologist said, the only treatment for this is to put you on long-term opioid therapy. And I was like, oh, no, thanks. I will accommodate. There was no way I was doing that. So I had to get through that, that was a little bit of a saga. But anyway, I had no disease then after that radiation, none. And so I was in this state, they call it NAD, or NED, no evidence of disease. I like to always say NED, right? I was NED for a really long time. I had no evidence of disease. It was a great place to be, right? Still on treatment, still trying to do everything to keep this from coming back, and started Gemzar. And, everybody had said all these terrible things about Cisplatin, and Gemzar was 10 times worse. Everyone was like, you'll be a breeze. Gemzar is a breeze compared to Cisplatin. You are really the exact opposite of everybody because, we used to tell patients Gemzar it's non-chemo. Yeah. Yeah, everybody tolerates Gemzar. I can still remember sitting, because I was feeling too crappy to drive, my mother driving to pick me up to take me to chemo one day, sitting on my front porch and throwing up in a plant on the way to chemo.
There are nutrients in there, Sarah, that are very good for the plant. So I wouldn't feel bad about that. It's a very healthy part of the carbon cycle, I'm sure.
But I was determined to, keep on. I was really close to getting switched to Taxols, which, I'm like, this is going to happen. That'll be better. So then had to take another trip for another meeting, and had lots of friends there. And I can remember them standing behind me after we had eaten, and they were pushing me up this hill in San Francisco because I literally couldn't walk. And I kept thinking to myself, I'm a hypochondriac. This is just because I'm anemic, whatever. I was super short of breath. But I'm like, okay, I had convinced myself I was making it all up in my mind. I fly back from that trip and the very next morning head in for chemo. And they immediately said, oh my God, no chemo. Everything is a mess. My liver numbers were through the roof. My kidney numbers were, high. I had pancytopenia so bad.
How anemic were you, Sarah?
So I was like 6 at this point. Okay. I mean, it was bad, really bad, the low 6s at this point.
Right. And just so the listener understands, yeah, the normal would be 13 or 14 of a hemoglobin and you're 6. So that's really low. And your platelets
bad.
Were how low?
23.
Which means you basically don't have the ability to form a single clot.
Right. I was a disaster. And the funny thing is I was still up and doing okay. You know what I mean? I was tired. I was shortness of breath with activity, but I was doing okay. And they sent me home. And I was like, that doesn't seem right. Am I crazy that I shouldn't be home? So of course I call some of my other physician friends. Aha, privilege, right? Because I was getting sent home. Mm-hmm. And they're like, oh my God, we're admitting you right now. Right? So I actually get a backdoor admission to the hospital. And a complete workup starting right then. I had to have a thoracentesis, drained a whole bunch from my lungs. That was unknown when I got sent home.
So you had tons of fluid around your lungs. That's
tons of fluid around my lungs.
Shortness of breath.
Yeah. And once I was admitted, I was promptly transferred to ICU. Things were going downhill. I had to be put on BiPAP. So I had multi-organ failure. I, had respiratory failure, liver failure, kidney failure. I was a big failure. Okay. Everything was bad.
And was this believed to be the result of your body's response to the tumor or the chemo?
It was the Gemzar. Yeah. So I got taken care of in the hospital. I just want to cry to think about the care I got. It was so wonderful, and I just had the best team. I would have died. Nobody can believe that this was well over a year ago now, and I'm healthy with no persistent failures because I was near death. And I was in the ICU for a really long time. And everyone, every day, it went from, I think your kidneys will rebound to 50-50. They're never going to be normal. I was on plasmapheresis, and it turned out I had something called atypical hemolytic uremic syndrome. And, to just explain, over 70% of people are either dead or on dialysis, right away. I mean, it's got an incredible mortality rate. Incredible. It's incredibly difficult to treat. And so, outcomes are you're dead or you're on permanent dialysis. And so I was put on a new medication after, going through kidney biopsies, all these kinds of things in the hospital. Sent home, did outpatient plasmapheresis for a while. And then things miraculously started getting better, right? Not miraculously, it was because of this medication I was put on. Of course, that meant an infusion every 8 weeks. And the worst part to me is it meant no one would put me back on chemo.
Just they wouldn't put you on Gemzar, or they wouldn't put you on anything?
Wouldn't put me on anything. And to me, that was devastating because I said, well, kidney failure is one thing, but, having this cancer that we know come back is another. So that was another hard pill to swallow. And, you know, long story short, I got better. I went to pharmacogenetics, which is where they actually take a look at what your genetic profile is in response to different drugs. And it turns out I had a genetic mutation. Hey, I have lots of them. It turns out I had a genetic mutation that didn't allow the Gemzar to break down. So I was getting toxic doses of this. And I was on a very low dose, but the thing is that I couldn't get rid of it. So normally if you see atypical hemolytic uremic syndrome with Gemzar, it's after months and months of treatment. And I got this within 4 weeks. Why? Because I was getting mega doses of it because my body couldn't get rid of it due to this mutation, was the explanation.
Wow.
So, you know, and they said, there's no reason you can't take any other chemo. This is very specific to Gemzar. But that was that. Sit and wait mode. Back to sit and wait mode. And it took another year, but the cancer came back in September of 2020. And here's my story from that, which really made me so determined to work even harder for health equity. Here I am, a physician, able to grasp really difficult concepts, able to read and scour the literature and know what I'm looking for, able to call at a moment in time, you know, anytime, someone to help me sort through something I didn't understand, or help maybe refer me to someone. You know, I had all the resources in the world. And the reoccurrence was in September. Even with all my constant pushing and self-advocacy. Okay, the one thing is I had, by the time I was diagnosed with cancer, I was an expert patient advocate. Expert. Hardcore. And, you know, one of the other advantages I had is it didn't take much to switch that and to become a self-advocate, an advocate for myself. So I was diagnosed in mid-September with a reoccurrence. I did not get on a clinical trial until I got started December 30th. That's a 4-month delay. That's a 4-month delay for me. And in hindsight, now, looking back, before I was panicked, right? And I couldn't really, I was like, something has to get done, something has to get done, something has to get done. I can look back in hindsight and say, how many people die during that time? How many people who don't have the advantages I had just die during that delay? How many? I shudder and I just want to cry. And what I've done is I've reached out to other cancer patients to say, has anyone else been in this situation? And I find out it happens all of the time. It seems that we have a really good system. As I experienced, when someone is diagnosed with cancer, they get a cancer navigator, you know, they get all these things and we're boom, 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 boom. But when that cancer comes back, it's kind of like the system seems to give up on you. I had to advocate the heck out of getting a biopsy done. A biopsy that would be enough tissue to make me eligible for a clinical trial. That would actually get me a full genomics report. I mean, that wasn't going to happen. I'm telling you, I had to get almost obnoxious about it. And the stories that I'm getting from people are the same.
Where was the recurrence?
In my right upper lobe. And so
you had to get another lung biopsy to do this. And can I ask you another thing, Sarah? What has been, you obviously have health insurance, but I assume that there's been a non-trivial amount of out-of-pocket costs as well in the last 4 years?
Oh, yeah.
Do you have a sense of what the out-of-pocket cost has been for your care?
Tens of thousands of dollars.
Which obviously speaks to another challenge. I don't know if this is still true, but it certainly was true at one point that the greatest source of personal bankruptcy in the United States is healthcare, an inability to pay healthcare costs.
And a cancer diagnosis is so high up there.
I would have to believe that cancer is the leading subset of that as well.
So, you know, so now I'm like, especially when I got feedback that I'm not alone in this. It wasn't just me, you know? And again, I always keep saying in the backdrop of I am one of the privileged. And I was put in this situation. And the fact of the matter is, by the time the reoccurrence was diagnosed to the time I finally got treated, I had progressed so much that I had compression in my bronchus. I couldn't get up a flight of stairs without desaturating. I mean, this all just happened. I was in horrible shape, which of course, again, and remember, I'm starting out, you know, before my diagnosis in general, I was so healthy. And so it just is, which gives me an advantage in this, which gives me a significant advantage in this. But it goes back to that question of how many people just die.
Sarah, you're very realistic about the fact that your time on this earth is less than it should be, right? A 49-year-old, otherwise healthy person who's done all the, you know, done the right things for their health should have another 40 years on this planet. And at least statistically speaking, doesn't seem likely. It suggests to me that you're very cognizant of how you spend your time. So I should take a moment to thank you for spending a couple hours with me here. But how do you now think about the time that you allocate to your family, to your work in the diabetes community, and now to this third important pillar to you, which is cancer advocacy? How are you managing that, and how do you think about how to even balance that? Because I think time is the most important currency. I think everybody can appreciate that in a vague sense. It is the great equalizer. But of course, most of us can't appreciate it the way you can, because you have a real visceral appreciation for it that comes exactly with this type of an illness. And so therefore, I think that your appreciation for the balancing act of what you described earlier, which is living your life to the fullest, regardless of its duration, that's your legacy. That's what your kids are going to remember about their mom. Being the advocate for other patients so that in 10 years, when another Sarah Hallberg gets this diagnosis, even if she doesn't have your education or your means, she can have an extension of life the way you do. It's a bit overwhelming for me to think about how I would do that, because as I put myself in your shoes, my intuition is I'd want to retreat from everything outside of life, everything outside of my family. Like I would imagine, and it's hard to put yourself in another person's shoes without being there, but my intuition is I would say I don't care about anything outside of the walls of this house. And I would take a selfish approach in some ways, I think. And you've done this very selfless thing, which is continuing to sort of prioritize everything else as well. How do you do that?
Well, a couple of things. You know, number one, believe it or not, originally it was actually hard to be around my kids when I was so deep in grief, because, and that sounds crazy, right? That sounds counterintuitive, but they reminded me of everything I was going to lose, right? They were what I didn't want to lose. And so it was challenging. And I knew I had to overcome that, you know, and that was a big motivator for me to not be, you know, thinking about that, in thinking in that way. And I'm happy to say I clearly have overcome that. But my kids come first. You know, I'll drop anything and everything if they need me now. But I also think, again, and I go back to sort of what I alluded to before, they need to see me not getting knocked out by the stressors and bad things in life, you know? I mean, bad things happen to good people. You know, like I said, there's been a pivot in every part of my career based on anger. And I certainly am angry about this. But what do you do with it? That's what's going to be the important question in life. You can take anger, you can take all these things, and you can get lost and buried in it, okay? Or you can try to turn it into, you know, something else. And I have to say, I haven't become as big a cancer advocate yet, and I'm working on it. But the reason for that is, and this was a question I had to ask myself a long time ago, which is, shouldn't you be a cancer advocate now? But I have a platform for diabetes. And damn it, that's important too. All these people suffering from this is important. So I can't just say, I'm going to switch away from a platform that I have to one where I don't yet. It doesn't mean I'm ignoring it. But it's like, it makes me want to work more again for health equity because it spans both. Right? It has to do with both diabetes and cancer, you know, and that is so important. So yeah, how I spend my time is really critical. And I want to say, it's not like I don't want to paint the picture that, oh my gosh, I'm the superwoman. I have a terminal cancer and yay, life is great. No. You know, when people ask how I'm doing, okay. If I say okay, you know I'm doing okay. There's never good or never great, okay? I mean, that's just where I live right now. I'm definitely not sitting around and feeling sorry for myself, okay? Definitely not enjoying things in life. But great is hard to think about. You know, great is hard to think about now. And, you know, some people say, well, cancer really helped me get a new perspective on life and what I care about. And, you know, I'm happy to say I don't know that I got that, okay? I mean, having cancer sucks, and I'm still mad about it. And, you know, sometimes I have to sit and have a pity party every once in a while, because the fact of the matter is I loved my life pre-cancer, and I think I was living every minute of it. I think I cherished my children. I cherished vacations. I mean, you know, that I cherished travel and showing my children travel. And that's, you know, that's a bit of a wonderful thing. And it's also like a dagger too. It's not like I've gotten some new life and new perspective that's so different from my old. Damn it, I liked my old life. And I liked the old me. And it's still a little hard to get used to who this person is now. She's still motivated. She still exercises, although not doing the things I used to. She loves her children with as much passion as one could have, but I'm fundamentally different. It's tough.
Sarah, you've said a lot of things that obviously resonate. And I think will resonate with a lot of people. So I want to thank you from the bottom of my heart, and certainly wish you the best.
Thanks. I appreciate it.
It's been great knowing you through this journey as well. You are As many of your colleagues have undoubtedly told you, and we've certainly discussed it behind your back, you are an inspiration, and nobody wants to hear that because nobody wants to be the inspiration. You just want to be the normal person, but you are an inspiration.
Normal person, yeah.
Yeah. Well, thank you for setting aside time.
Thank you. Yeah, and I mean, I thank you so much for having me on. I mean, believe it or not, this is the first time I've told my story, you know, in any way, shape, or form. So I have been kind of preparing for this, and I'm glad I did it. And so thank you for giving me an opportunity to do that. And thank you.
Thank you for trusting us. Thank you for trusting me and the listeners.